Hi, and welcome back. My name is Dr. Kat Kesty. I'm a double board-certified dermatologist and fellowship-trained laser surgeon. And today we are going to be talking about the most common questions about lasers and facial aging. So today we're going to be answering questions that commonly come up from viewers or patients of mine. So let's start with the first question. What causes brown spots and red spots on the face? So the two things that are going to cause most brown spots and most red spots are going to be sun and the normal natural aging process. Now, some people have a genetic component to this if they're more likely to get things like cherry angiomas or seborrheic keratoses, but the majority of the red and brown spots that come up on your face are going to be due to sun and the aging process. I tell patients if you want to look at for skin that hasn't had any sun, what your face would look like with no sun exposure, look at places like your abdomen or your bottom, places that don't ever get exposed to sun. That's going to be your highest quality skin. Let's answer the next question. Are dark spots always caused by sun, or do hormones play a role? And this is absolutely true. The majority of dark spots are caused by the sun, but for some people who have melasma, hormones can play a role. What that means is that when you have a tendency to get melasma or you've been diagnosed with melasma, those hormones that make us female can make us much more sensitive to the sun. So for people without melasma, they could go out in the sun for 15, 30 minutes, maybe a full hour, and not get any dyspigmentation or brown spots. For people who have melasma, the female hormones play a role in how the sun and the skin interact. So even with very brief periods of sun exposure, walking your dog, walking to the car, getting the mail, you can have that hyperpigmentation, and hormones definitely play a role. So let's answer the next question, which is why do some brown spots fade on their own and others do not? And this is a great question. And the reason why is that it depends on what the brown spot is. Things like freckles that you get from the sun, if you avoid the sun, they will go away eventually. But things like seborrheic keratoses and solar lentigos, those things you need a laser to treat or they will never go away. Seborrheic keratoses in general get darker or they can get more raised, but they're not going to go away unless you treat them. Things like freckles and sometimes even melasma can go down and fade themselves if you avoid the sun. The next question I get a lot is, can redness and broken blood vessels worsen over time if untreated? And I would say definitely yes. Things like background redness from sun exposure or untreated rosacea or just the normal natural aging process, what happens is those blood vessels, they dilate and then they constrict and they dilate and they constrict, and eventually they just stay dilated and they look like either background redness on the face or discrete little red veins on the face. And the only way to treat that is with laser, because once those vessels are dilated, they're stuck there unless you use a laser to target them. So if you have background redness or you have rosacea or you have sun damage that causes red veins on your face, laser is definitely the answer. And untreated, they will get worse. So the next question is, how do lasers remove pigment without damaging the skin? And this is really the beauty of the precision of lasers, is that we have all these different lasers that we can use to target the brown lesion, whatever that is. Are we talking about a freckle? Are we talking about a seborrheic keratoses? Are we talking about melasma? Are we talking about dyspigmentation and a scar? You know, depending on what is causing the brown spot, we have a laser or a series of lasers or a set of lasers that will treat that particular type of brown spot. And lasers are so ultra precise that what we do is we use a laser to target the brown and leave the rest of the skin alone. The next question is, what is the difference between IPL and lasers? And some people are confused and think that IPL is a laser, but technically it is not a laser. IPL is a flash lamp, so you're going to get a lot of different wavelengths of lasers, usually from about 400 to 1200 nanometers. A true laser is where we take all of the light and we only direct one wavelength. So whether we're talking about 532, 1064, 1550, 2940, 10,600. Those are all lasers. And the reason why they're lasers is because it's just one wavelength. IPL, you use a filter to cut it off. So if you're using a 515 filter, you get all of the wavelengths between 515 and about 1200. So it's not technically a laser. It would be technically an energy-based device, which means we're using light energy to treat something in the skin. So that's why the results from IPL and or BBL are not as precise as lasers. It's not that they're bad energy devices. I use a lot of IPL, BBL in my practice, but it's not going to be as targeted and as precise as a laser. So you have to choose the right situation, the right patient, and combining it with other lasers can be very nice, and you can have a very nice outcome with that as well. So the next question is, are there particular lasers that are better for brown spots and or redness? And I would say definitely yes. Whoever asked this question has a good understanding of lasers, because when you think about lasers in general, every single type of brown spot is going to have a particular laser that's the best at treating that. Every type of red spot is going to have a particular laser that's the best at treating that, and or settings within that laser. Even when you're talking about a cherry angioma versus a telangiectasia or red vein on the face, they're both going to be 532 lasers, or 595 would be the two that are best at that, but you're going to have different settings because they're different. So same with brown spots. You have, 1927, you have 2940, you have 10,600, you have 532 and 1064, you have the Q-switch lasers and the picosecond lasers. All of these types of lasers are what you need in your laser practice if you want to treat every patient that walks in the door and every type of brown spot. If you only have one laser, you may only be able to treat one or two types of brown spots. So that gets to the next question, which I get asked a lot, which is, how do you choose a laser wavelength? When a patient's in front of you and they have aging or fine lines or round spots, red spots, acne scars, what is it? How do you choose the right wavelength? And I would say, as a laser surgeon, you have to understand each different wavelength and each different laser that's out there that's available to you, and really be able to precisely pick the wavelength, so the laser and the settings for that particular patient on that day. And that's what I love about lasers. That's what I love about my practice here in Florida, is that we have all the lasers and we're both laser surgeons. So what we do all day, every day is we have a patient come in, we talk about what their goals are, and then we make a plan and we do lasers on them based on what their skin looks like, their downtime, their cosmetic goals, all of these factors that go into choosing wavelengths. And that's the fun part of lasers, because you're really customizing every single treatment for that patient on that day. So it's really fun being able to choose from all the different wavelengths. It's really the best job in the world because of that. There's no protocol that you could possibly follow to get great results for lasers, because that's just not how lasers work. Let's talk about a really common misconception and the question behind it, which is, are lasers safe for darker skin tones? And I would say absolutely yes. Any color skin you have, any ethnicity, any ancestry, any age, any concern, I would definitely see a laser surgeon, because they will have the laser that is appropriate for your skin to reach your cosmetic goals. And I think knowing which lasers and which settings in which skin type for which concern, that's kind of the art and the science of being a laser surgeon, is being able to deliver those results to patients safely and effectively, regardless of their skin type, age, all these other factors. So let's talk about what to expect. What are the most common side effects after pigment or vascular laser treatments? So I would say the vascular laser treatments, those are going to be in general very minimal downtime laser procedures. You may look like you just worked out or be red for a couple hours afterwards, but in general, about 24 hours after any vascular laser, you can go back to your normal daily activities. After a pigment-specific laser, that is going to have more downtime, because what we're doing when we're targeting the pigment is we're basically removing it from the skin, and it takes a while for the healthy skin underneath to push it up. So usually there is anywhere from 2 to 5 days downtime when we are doing a pigment specific laser. So one question I get a lot is, can lasers cause burns, scarring, and worsening dyspigmentation? And I would say absolutely, a laser in the wrong hands can definitely cause a lot of problems for patients. You have to have the right laser at the right settings for the patient's skin type, cosmetic concern, and downtime. And when there's a mismatch between the right laser, right settings, and the patient, that's when you can get worsening of their disease. For example, melasma. I see very commonly that people that are not laser surgeons will use something like an IPL or BBL to treat melasma. And this is a horrible idea. I never use it because what happens is that when you deliver laser energy with an IPL or BBL, you're delivering too many wavelengths. It's not a specific wavelength. There's too much heat going into that skin, and it's too superficial where that pigment sits in melasma. So that heat pools and then it worsens the melasma. So you have to have the right laser, the right setting, the right patient. Without that perfect mix, you can get into a lot of trouble with lasers. So the next question is, how many laser sessions am I going to need to see visible improvement? And I would say it really depends on what you're treating. If it's something like a seborrheic keratosis or freckles, that's going to be 1 to 3 sessions probably with a good laser surgeon. If it's something like rosacea or red veins or telangiectasias, something like that on the face, you can do 4 to 6 sessions before you start seeing really major results. So it just depends. My recommendation is to find a good laser surgeon, and we have videos on how to find a good laser surgeon in our library, and ask them because they are the experts. They will know exactly after doing a consult with you and looking at your skin, how many sessions to expect and what kind of results exactly you can expect. Thank you so much for listening to our episode about commonly asked laser questions. If you have any questions or comments, please feel free to DM us or leave them below. Thank you.